Welcome to this video. These days, a lot of people are very conscious about their health, especially their blood pressure. They always check their blood pressures, either to make sure it doesn't go up or to be able to quickly detect it in case it goes up, or maybe they have been already diagnosed with hypertension. Hence, they monitor their blood pressure regularly in order to check whether the medication that they are on is working well. Now, that is a good thing. However, do you understand what the numbers in the BP reading, do you understand what they mean? Whenever you get your BP checked, you are handed the results, and then you see the numbers. What do they mean? Okay, so let's look at what the numbers mean. First of all, when you look at the BP reading, you will notice that there are two numbers. There are two numbers that are there. There is a top one. So you have the top one. That's the first number. For example, so let's assume that you checked your blood pressure and it's 120/80. So this is the top number, and the top number is known as your systolic blood pressure. Then there is a second number, which is the down number, and this is known as the diastolic blood pressure. Now, what does the systolic blood pressure mean? So the top number, or the first number, what it means is that now when your heart beats, what happens is that your heart squeezes. So the heart squeezes and pushes blood through your arteries to the rest of your body. Now, as the heart contracts, or as it squeezes to push the blood through the artery, it exerts pressure on the arteries. So that pressure is what is known as the systolic blood pressure. In other words, the systolic blood pressure is the pressure that is exerted on your arteries as your heart contracts, or as your heart squeezes in order to pump blood to the rest of your body. Okay, then the diastolic, what does it mean? That's the down number. What does it mean? So the diastolic is the pressure that is exerted on your arteries when your heart relaxes, or when the heart rests in between the beats. So the heart contracts, or the heart beats, relaxes, and beats. So after contracting and pushing blood to the rest of the body, the heart takes a short break and then contracts again. So in between the beats, each beat, the heart rests, and that is when the heart gets filled with blood and oxygen from your lungs. Then the cycle continues again. Okay, so now let's look at the average normal BP, and then when you should be worried after checking your blood pressure. Now, the normal BP is considered around 120/80 or less. So any blood pressure that is 120/80 or less is considered normal. Then any blood pressure that is 140/90 or more means the person has hypertension. Then any blood pressure that is 90/60 or less, it implies that the person has hypotension or low blood pressure. And when it comes to the hypotension or low blood pressure, usually it's not a problem that much. However, it increases your risk of feeling dizzy or fainting, and commonly it is a sign of, or it may be a sign of, another health problem. So if your BP is this low, please see your doctor for further examination to be sure that you don't have any other health problem that may be coming up. So please take note of the values, and I encourage you to check your blood pressure, monitor your blood pressure to know the average, so that when you go to the hospital and they check your blood pressure and it's beyond, you will know that no, my normal blood pressure is usually 120/80. Something might have happened. So they know that that is not your normal. It has gone up or it has dropped. So please, let's take care of ourselves, monitor your blood pressure, and the next time you get your blood pressure checked, don't forget this. The top number is called the systolic blood pressure, and it is the pressure exerted on your arteries as your heart contracts to push blood through the arteries to the rest of your body. And the bottom number, or the second number, is the diastolic blood pressure, and that is the pressure that is exerted on your arteries as your heart relaxes in between beats. So as your heart refills with blood, this is the pressure that is exerted on your arteries. And the top one is usually higher than the down one, or the second one. So please take good care of yourself and check your blood pressure. Thank you, and please watch out for more videos.